My name is Will Sims. I'm the Deputy Manager of the Lung Function Service and GI Physiology Service. We're here today to try and help support the use of CPAP therapy and delivery in COVID-19. So the CPAP therapy device will be connected to the patient via a circuit or tubing, an exhalation port, a bacterial viral filter, an elbow with oxygen entrainment into the patient's mask. There are a variety of circuits that we're currently using, which I want to just show you very quickly. So these three systems we've pieced together, and you can see they're all essentially the same but look very different. You all have a tube that connects into the therapy device itself. With the first tube, you have your exhalation port, then your bacterial viral filter, which will then plug directly into your face mask on the patient. On the second tube, you have your main tubing, you have a different exhalation port, and then your bacterial viral filter, which again will plug directly into your mask attachment. The third type of tube you may experience seeing has an exhalation valve here. It has an oxygen port here which needs to remain closed and capped off and sealed. And ultimately then your bacterial viral filter again, which again plugs directly into your therapy mask. The therapy mask that we're currently using, again you may experience some variation in. We've had to adapt masks to allow us to use them within this circuit because of the fact that we're dealing with an aerosol generating procedure. What you will find is either an orange elbow or a clear elbow. On the orange elbow, what you will notice is you have a little anti-asphyxiation valve, this little white silicone valve, and on the top here there is a second valve which you can see has actually been sealed with red silicone. This is actually the leak valve, which we don't want to occur. The reason for that being we want the patient's breath to actually be filtered by the filter attachment prior to exhalation out of the device itself. The orange elbows have also been clearly marked that they've been adapted with black marker, so we know that they're not as they are standard. When you're entraining oxygen into the mask, it's important to entrain it through the orange elbow here, not through the points on the mask and not through any points on the tube system at all. This is the DreamStation CPAP therapy device. They're preset to a pressure of 10, or as in the indication on this one, 15 centimetres of water. They're very simple and easy to operate. You have two controls on the top. The only control you need to concern yourself with is the long, universal on and off button. Once you've got the patient attached to the device, which we'll discuss shortly, literally press the on and off button. The device will start blowing at that set pressure of 15 or 10 centimetres of water. To turn the therapy device off, just press the button again. So we're now going to just quickly show you how to build the circuit. So you have your therapy device and your air outlet. We're going to plug the end, which has not got the bacterial filter on, into the air outlet, pushing it on nice and firmly. You can then connect into your mask your bacterial filter. At this point, you can then entrain your oxygen supply into the orange elbow underneath and set the oxygen requirement that you need. Once you've set your wall oxygen flow rate, connect your mask to the patient, which has been shown in other trust videos, so I'm not going to go through that component. And then all you need to do is turn the device on by pressing the on and off button to start the machine blowing. Thank you for watching the video. Hopefully it will make life a little bit easier for you. If there are any problems or concerns, both Beverly, my line manager, or myself will be available for periods at various times through direct contact with Trust Mobiles, which are being provided, and the wards should have access to those telephone numbers.